Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about ICD-10 CM PCS updates 2023 third quarter part 6. In this video, we are going to cover two coding clinics. The first one is, what is the appropriate code assignment for gastrojejunal stenosis in a patient who is status post gastric bypass? And the next coding clinic we are going to cover is intersusception along with gastric outlet obstruction at the gastrojejunal junction. Is it appropriate to report a post-operative complication code for intersusception at the anastomotic site? So let us begin with the first one. What is the appropriate code assignment for gastrojejunal stenosis in a patient who is status post gastric bypass? Let us begin with the scenario. A 31-year-old patient with a history of Roux-en-Y gastric bypass presents due to gastrojejunal stenosis. As you can see in the image, the patient has already underwent Roux-en-Y gastric bypass and now presents due to gastrojejunal stenosis. Okay, and EGD with dilation of the stenosis was performed. So the provider has performed the EGD to dilate the stenosis. So the question is, what is the appropriate code assignment for gastrojejunal stenosis in a patient with status post gastric bypass? And the answer is, we have to assign the code K56699. That is, other intestinal obstruction unspecified as to partial versus complete obstruction for gastrojejunal stenosis. Stenosis of the gastrojejunal site is classified as obstruction of the intestine. It would not be appropriate to report this condition as a post-operative complication without provider documentation indicating it as such. So without provider documentation of post-operative complication, we should not take it as a post-operative complication, but we have to take it as a other intestinal obstruction. Let's move to next coding clinic. The next coding clinic is intersusception along with gastric outlet obstruction at the gastrojejunal junction. Is it appropriate to report a post-operative complication code for intersusception at the anastomotic site? Now let us begin with the scenario. A patient with a remote past surgical history of Whipple procedure and gastric bypass surgery due to pancreatic cancer presents due to severe abdominal pain, nausea and vomiting, abdominal distension, and constipation. So the patient has already underwent Whipple procedure and gastric bypass surgery because of the pancreatic cancer, and now the patient is coming with these symptoms: abdominal pain, nausea, vomiting, abdominal distension, and constipation. So let us see what is Whipple procedure is. It involves removing the head of the pancreas, the first part of the small intestine, the gallbladder, the bile duct, and portion of the stomach. Let's get back to the scenario. A patient with remote past surgical history of Whipple procedure and gastric bypass surgery due to pancreatic cancer presents due to severe abdominal pain, nausea, vomiting, abdominal distension, and constipation. The provider diagnosed intersusception along with gastric outlet obstruction at the gastrojejunal junction. Intersusception means telescoping of the intestines, and gastric outlet obstruction means obstruction at the distal part of the stomach, that is pylorus. So as you can see in the image, the intersusception and gastric outlet obstruction at the gastrojejunal junction. Okay, the question is it appropriate to report a post-operative complication code for intersusception at the anastomotic site? Additionally, gastric outlet obstruction is classified to pyloric stenosis. However, this patient is status post Whipple procedure, so this code does not seem appropriate. What are the appropriate code assignment for this patient? Answer is, assign code K561, intersusception for intersusception at the gastrojejunal anastomosis. It would not be appropriate to report this as a complication code. Gastric outlet obstruction is classified to code K31.1, adult hypertrophic pyloric stenosis, which is not appropriate in this case since the patient is status post Whipple surgery and no longer has a pylorus. So as the patient has already underwent Whipple procedure, that is part of the stomach, that is pylorus, is already removed. So it is this code K31.1, that is adult hypertrophic pyloric stenosis, is not appropriate as the patient is no longer has the pylorus.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.